Well, we're back again, folks. Hello, folks. This is Shippy the Explorer, Mrs. Ship Explorer. Long time we don't get together like this. Last time you saw us like this, we were dancing, some of the crip dance and in the same background, and oh my golly! And no, a year after, not even a year after,
Less than a year.
maybe 8 months. You never know what's going to happen. In 8 months, my left hip has deteriorated and can't even walk at times. And I remind you that I was an athlete, top high jumper in 1972 in Jamaica.
And
So,
runner.
and runner and mountain climber and jump out of tree 30 feet.
Shot put,
Yeah.
shot put and all that.
Yeah. But welcome to this station. This is Shippy the Explorer. Remind you that you're watching this medium, and we have been doing a series of videos concerning this hip. And I went to Jamaica and I came back, and after that excursion, I decided to finally do the operation. So today's tape is just to, you have seen how we have demonstrated something around the equipment. You'll see those videos and some of the equipment you need to get, and and uh, and we have talked about some of the food and the preparation for that. We have talked about the exercise, and some of the exercises when you plan to do this operation. And I find that as soon as I started with the operation, I mean the exercises, I somehow my body feels strengthened. And I even made a comment that maybe if I was doing these exercises, I probably wouldn't be doing this operation. But we have come to the conclusion where we're going to do the operation, and that's this week. And this tape is to really take a different perspective of how we go about it. We, a lot of you face similar operation, and you just don't run into these things haphazardly. It takes preparation and a lot of thinking and rethinking and planning with the doctor, with your primary doctor, with your specialist, with the clinic or the hospital, and the insurance and the therapist. So that's another thing. Therapy will come as soon as you finish the operation. So that's what is expected. But we, as a family, we just want to put this tape out to say, to demonstrate what we are going through and how do we feel, And we have dealt with the spiritual side. We go to church and we have a whole team of church, 50, 60 people standing behind us, including prayers, and all of a sudden we'll be getting a lot of support. And of course, the ultimate person, which is God and Christ. So we have, and you have heard, well, you haven't heard that, but we do know, I can tell you that we have friends on that side also. So, before we talk about the operation and demonstrate some of the things, Shirley is a registered nurse, and she has seen some of the rehab people that come to her nursing home. You have seen that, right?
Yeah.
Well, you can talk about a little of that.
Okay, I know Laurel had asked me to discuss the nautical site where you possibly could have the surgery there are 3 areas that they focus on, and the surgeon would be the one choosing the site. The anterior would
Then
be
I
in
could
front.
demonstrate. Let
The
me.
hip.
You can. I'll stand up and you show me. In my case, I'm doing
Okay, so
my
you don't have to
my left
put on
hip.
your pants.
Just
put it on.
alright. It's okay.
Okay, so in this case, this is left hip.
So these are the possibilities of.
So the surgeon will choose which position or which site he want to use. Find the hip here. So the anterior would be somewhere in the front that he would probably
front.
make the cut. The lateral would be to the side, some place here, and posterior will be right here behind the hip area. So you have 3 special areas that they have to choose from. As I said to you, the surgeon is the one that will choose which side he likes to do the surgery on.
So I've seen a number of videos, and they said the side one is a what?
Lateral.
The lateral. When they go through the lateral side, when they go inside, they have to remove some of the lift up some of the. Is it the ligaments or the
Yeah, they're gonna
ligaments?
cut
to
into
get-
the skin, into ligament and some muscle too,
But
to
they don't
get
cut the
down
ligament. You have to
into
lift it up or move it aside.
to
and-
get to the
and-
hip.
Yeah.
Then they will remove that bad hip joint. Actually, they will cut it off, and fit with a new prosthesis joint into the same socket. And also, what they do is like a cement into the femur, and they have the prosthesis stick down into that cement area.
In the bone.
Yeah, in the middle,
thigh bone.
middle of the.
And the thigh bone is really hollow, so they have that cavity. They're not, when they drive that metal thing in, they're not really removing marrow or anything like that, it seems. So,
To get it in,
yeah.
and the cement or whatever they use.
Sometimes they don't use cement. It all depends.
It depends what
Yeah.
material they're gonna use.
Yeah.
And they're gonna expect you to do therapy as soon as you recover from the anesthesia. They will let you try and walk. And again, this is gonna be in and out surgery.
Yeah.
So hopefully everything will go well. So.
Well, in and out surgery takes place at the operating centers, these operating centers, but also at the, even if you do it at the hospital, it's somewhat of an in and out situation.
Yeah.
So, because the doctor told me that he preferred do it at the operating center because it's less chance of infection. And
that's one of the main thing.
yeah.
Infection, and they're because of the trauma that the area goes through, you're gonna have pain.
Right.
There's gonna be pain, so you have to be mindful of that. There could be bleeding and also potential for clots. So that's why after surgery you have to move around, try to prevent the clots and get mobile again.
And it's surprising. They say get up and walk. I mean, walk immediately after the surgery, folks. So once you're clear,
The anesthesia.
anesthesia is clears off a
You're
little bit.
okay.
They encourage you to start walking.
Walking.
And they are saying that the hip operation is more
Compare.
successful compared to
People have said they have who have both knee and hip. They said the hip for them was it healed faster than the knee and also less painful. So hopefully that will happen in Laurel's case. A speedy recovery and heal fast.
One of the things that you will probably say, one of the difficult things we are finding right now in this country is the discrepancy with the insurance. We find that there are different types of insurances in this country, and it seems like based on what you have, there's a little bit of hesitancy in providing, no,
Here.
covering the costs of the operation is fine. That's the insurance part of that is fine. But what we have found is the therapy. What's it called?
In network.
No, but what's the name of the
Physical therapy.
PT? PT process. It seems like there are different things. Some people, the doctor needs to write an order.
Yeah, you have
to
to have an order.
To
And in
get
your
the-
case, what they did, they send your order to a physical therapy area that is not in network with your insurance. So that's a problem. So they're gonna expect you to do out of pocket and then reimbursement from the insurance. That's what we're trying to avoid, that
Yeah.
we would have somebody in network of the insurance and we just pay the deductible and that's it.
So people understand what I mean by network.
Yes.
I mean simple
Yeah.
thing means.
Yes.
The network means what?
Okay. The network of the insurance, for example, you have some places doesn't work with some insurance company.
Right.
So therefore, the insurance has a list of people and they, in their network, they call their list, these are the physical therapy.
People who they work with.
Yeah, that we work with. So if the order didn't go to one of those that they work with, they're gonna, expect you to do the payment and then reimbursement,
Which is quite
not
high. It
good.
was 200 and something, almost 240, maybe 250 per session.
Yeah.
And one session, I think a session is maybe 30 minutes if you're not careful. I don't think it's an hour. They didn't say the time, but so, and you need 6, don't let them fool you, you need 6 sessions immediately after surgery, 6 days of
Therapy.
Therapy with this type of operation.
And cold pack to help with the swelling.
So that's part of the equipment that we showed. But so we have to. So right now, we have a couple of days or 3 days before the operation. So we have to tomorrow morning. It's business, fast and furious. We have to make sure that we call the insurance and insurance find
Physical
therapy office
under their network.
under the network to work with me through this process. So don't let the old system fool us, folks. It's it seems like it's not a standard thing that goes across the whole country, and a little bit plain goes around. and I'm not even gonna say what I think is happening. But it seems like some people get better service than some people. So that's a problem in I would say, the whole hospitalization in the country. So, that's the thing. But so if we encourage people to do these operations, especially the doctors, the primary doctors, and it makes it look so easy. But
Yeah.
this thing gonna come, as Shirley says, it's gonna
Of
come
course,
with
they'll
pain.
say, oh, it's just a little surgery. There no minor surgery. As long as they cut into you, that is trauma right there. And you're gonna have some pain. So we have to be on top of pain management so the patient can be comfortable.
Mhm.
That is important.
And you have what type of pain management? You don't want to use aspirins.
Yeah, nothing with aspirin. I'm
Like
sure
what?
you have to use something with Tylenol number 3, or any pain medication without the aspirin, but the doctor should prescribe that for you.
Mhm. And you have to watch out for some of the natural. Some of us are naturalists. We're using certain foods. I understand that ginger and turmeric
Hmm.
you're not supposed to take
During that time.
during that time.
Mhm.
2 days before the operation starts, going to the operation, the patient is not allowed to shave, especially for a man like me.
No lotion.
No lotion and no perfume to make myself sweet, to make the nurses feel good. No oils on the body.
Take off your
You
chain.
Take
and
off the
jewelry.
chain and jewelry and all that. You don't want to go to the operation room looking like you're going to do a movie, with lipstick on, on your lips,
No
and,
oil,
and,
no
and
deodorant,
oil on
nothing.
your cheek
Just-
and all sort of things.
Mhm.
It's a plain thing. Um, that's one of those things we deal with. What else we can talk about is we talk about equipment and all that. We talk about pain tablets. Food, we can remind you that I understand we're not supposed to eat anything 12 or 24 hours.
After midnight, before
After
the
midnight.
surgery, they said NPO, nothing by mouth, after 12. 12 is like the following day. 12
12
a.m.
midnight the day before.
You're not supposed to eat or drink anything except your medication with a little
Important
sip of
medications.
water. Yeah, the aspirin or any other medication that have the aspirin, your vitamin D, you have to avoid that. And also that other pain medicine, it said not to take that one. That
Then,
little one.
in my case, I've been dabbling in the molluscum
Molluscum.
for a little bit, and that needs to stop. Vitamin D2, that needs to stop also. And
A week,
yeah,
actually. A week
yes,
before
a week before.
surgery.
Yeah, a lot of preparation, folks. Food here, it's important. We're gonna repeat that the exercise really help. You have to try to strengthen whatever muscles you have at this before the operation, pre-op, and then you're getting nutrient. We are boosting up the protein,
Vitamin.
you know. So I've been taking my shakes, not the sweet one that I make myself on the road, but something from
Ensure,
in life.
In life.
In life.
So
So
it has enough protein and nutrient in it to kind of, maintain your body.
yeah. So they're fattening me up for this operation, folks. Technically.
Because most times when you're sick, you don't feel like eating. So when
Yeah.
you can eat and enjoy your food, you do. Because if you're not well, you don't have no appetite. So it's best to nourish your body, especially during the time, you're gonna have surgery. Hydrate your body, because you're not gonna be able to drink anything after you take those medicine with that sip of water after the surgery. And presently we are not sure about the time
And that's a
of
personal thing,
surgery yet. So they will inform us.
Yeah.
We don't know.
It's a whole day. I understand the operating room, they start at 6 something in the morning, so it could be any time during the day.
That's it.
So I mean a little bit more about the emotional side. We don't want to come across as this is something simple. It's something necessary, and I've had enough operation in my life to say, well, I wouldn't do anymore. But when I reached, I'll tell you a joke, folks. When I came home and we live a little bit on a hill, like, and I went down to carry the trash can or put something in the trash bin. I think that was it. Or I went down the gate. And believe me, I got stuck on the hill.
Without your cane. You didn't have
Yes,
your
I didn't
cane.
have my canes, and I couldn't go forward, I couldn't go backward. I probably could have gone sideways. So when you reach that point in your physical health stage, and you're finding it that difficult, you forget all about the past surgeries that you have had. Because I said a week ago, when one of the pain came on, I said, man, this thing, I need to take it out right now. Feel like you could just go inside the body and take it out right now, because you're so immobilized and having pain. You just feel like you'll know when the moment. That's what the doctor said, and I think that's happening to me. It has happened a number of times. So you'll know when your body, you need to do the operation. So I'm just concerned about, my main concern is the anesthetic,
Anesthesia.
anesthesia.
Because you don't tolerate that too well.
Yeah, some of us don't make you want to sleep too much, like you take a bottle of rum or something. So that's concern. And
Hopefully, hope the surgeon who's doing the surgery just do the right thing. Just may God guide his hands so he can cut wherever he needs to cut in the right position, so everything will go well.
Yeah.
That's all I can hope and pray for at this time.
Yeah, but we have heard good things about this type of operation, folks. So, that's why we're looking forward to it. We just know that we have to do it. So, the countdown is here on top of us, and so that's why we're doing this tape, to really, as Shippy the Explorer, I'll release this tape of Life Spear maybe the day before or the morning off, and then I'll probably take a break for this whole vlogging for a couple of days. Depends on how I feel. If you don't see tapes coming through, you know that I'm resting, as best as possible. So this tape, as I said, is just to inform you of and encourage you of what a hip operation is about. We don't have the graphics. You can go into Google and look it up and see how that is done, but that's not where we are mainly coming from. We are talking about, it's so often you see people doing operations with, as a family, how we handle it and what we do feel about it. I don't know if you...
And again, it's gonna be a total hip replacement.
Is it total?
Yeah. They're gonna cut that.
You sure? It's
Yeah,
total.
it's a
Because
total hip
hip
replacement.
contains
Not
the
back,
pelvic
the socket. The
yeah.
socket. So that's what they're gonna move, that
Well, if
socket.
somebody can
Put a
make
new
comment,
one in.
yeah, if that's the, if we are wrong in that case, because I thought hip is part of the pelvic bone, but you're not going to remove the pelvic bone.
No, the hip is right here.
Because in your
joint.
field, I've seen people that come into your office with broken
Yeah, that
pelvic.
for rehab. Yeah, that's a different thing. The pelvic, that's different.
But
Right,
pelvic is part
yeah.
of the hip.
Yeah, but it's not the pelvic that they're gonna.
No, but that's
do
when you say total replacement. That's what
of
I,
the hip.
but I said,
All right, let's not.
well, that's a debate. All right. So we'll keep you informed, folks. The Ship It Explorer, I bring you all sorts of things and information about life. And you'll keep us in your prayers, and I think we'll be all right as we get.
Just think positive.
Think positive.
Everything will go well.
Had enough food and thing to go through this. So, all right. So until then, if you find a bit of information in this and you're going through, and our family members going through the same thing, you can share this tape, like it and share it, and if you're coming across this station for the first time, we encourage you to subscribe, folks, and share this information to others, because we're taking this bit of this operation at a different level, not just going and showing the technical thing. We're showing the family and the complete, comprehensive way of going about it, and how an ordinary couple deal with an hip operation. So thanks for watching, and thanks for sharing, and thanks for subscribing, folks. And we'll see you at the after all of this, and hopefully still have my smile. And
Thanks for your prayer, everyone. Thank you.
Good. So take care of yourself and others, and we're saying we're out for now.